Good afternoon, everyone, and welcome to this discussion about coronavirus and the respiratory system. My name is Dr. Kapoor Karuga. I'm an ENT specialist based at CityHealth Hospital, which is on Tomboya Street, Odeon Cinema, on the first floor. I also have a practice in Upper Hill called Prodigy Medical Services at KMA Center on the third floor. So I know everyone is really concerned about coronavirus and its effect on the respiratory system. And truly, it is a disease that has affected the entire world. And we are all grappling with what to do next and how to deal with the virus. So every day we hear numbers increasing, that there are more patients being found to be positive, more people are getting sick, and also, unfortunately, we are losing patients. Unfortunately, the virus currently has no cure and has no vaccine. What that means is that it is still a virus that is going to spread worldwide, and therefore we must take care of ourselves and be able to prevent infection. In this case, for sure, prevention is better than cure, especially because there is no cure. So, in terms of coronavirus and the respiratory system, now, coronavirus is a novel virus. What does that mean? It means that this is a virus that has just been discovered and has just begun infecting humans. It was initially affecting animals, and it was thought that it jumped from animal to animal infection, that is from bats, and now started infecting human beings. So one way or another, there was a mutation that made it possible for it to infect from one human to another. Now, this happens a lot. In fact, if you look at the world, we have about 10 to the power 31 viruses existing. Now, most of these viruses don't affect humans, although many do affect humans. There's some famous ones, for example, measles, smallpox, chickenpox, mumps. All these are different types of viruses. There are also many different types of respiratory viruses, including coronaviruses, that affect human beings. Many of us actually get upper respiratory tract infections, what you call common colds or flus. And these are actually different types of viruses, including coronaviruses, syncytial viruses, respiratory syncytial viruses, adenoviruses, that affect humans and cause respiratory tract infections. Now, coronavirus in itself is an RNA virus, and what this means is that the virus in itself cannot replicate. What it does is that once it enters the nose or the respiratory tract of a human being, it then uses the cells of a human to make its own genomic or sequence of genetic material, and then also make its protein, and that is what is now extruded from the cell and becomes an infectious particle. So first of all, most of the infections occur through the nose, because the nose is the first contact to the environment in terms of respiration. So you get particles or droplets which have infected material with the coronavirus, and these attach to the mucosa of the nose, and there's a particular enzyme known as the angiotensin converting enzyme that has also been found in the nose, and this is the one that is thought to be the #1 receptor for this virus. And once it starts replicating in the nose, by day 1, it can actually be found in the saliva as well. So this means that probably after a day or two, a person who has been infected by the COVID or coronavirus is actually also infectious to other people. Now, one of the main symptoms we may get initially is either loss of smell or loss of taste, and this is because the cells that are in the nose for smell are actually infected by the coronavirus quite early on. Some people may get fever, a cough, feeling fatigue or general malaise. Some people may get respiratory distress, although the issue of respiratory distress usually comes a few days after the infection has taken place. It it has been shown or been found that the critical period is between the 7th and the 10th day, in which case many patients actually get worse and develop difficulty in breathing and cough and high fevers. This is a critical period because many a times if this period is overcome and the patient is able to recover from this, then they do get improvement and recover fully. Now, so how does this virus spread? As I said earlier, the spread is mainly droplet infection. So we're talking about when you cough or you sneeze or when you're talking, there are droplets that are forming and are being released from the mouth or from the nose, and these droplets are containing the coronavirus. Now these droplets, when they're in contact with somebody else's mucosa, that is the mouth, the nose, or the eyes, then they can be taken up by the cells of the body and the replication begins. So how do you prevent yourself from getting infected? Number one is to prevent the direct droplet infections. That means preventing inhalation of droplets from somebody else. So one thing is to keep a distance, allow at least let's say 6 feet. So this prevents direct contact with the droplets from somebody else, and thus will prevent you from getting infection. So that is what is known as the social distancing. Another thing that you may do is wearing masks. So as we said, because the virus is coming in through the respiratory system, when we wear a mask, we are covering our nose and our mouths. So one, we're preventing ourselves from infecting others in case we have the virus, and we're also preventing others from getting infected. So we're preventing people from getting infected from us if we have the virus, and we're also preventing ourselves getting in contact with viruses from somebody else. Okay, so a mask is very important in terms of helping us to prevent that intake of the virus. Another thing that the mask will do is it will also prevent you from touching your face, your mouth, and your nose. And this is important because another way of spread of this virus is through contact of what you call fomites. Now, fomites are surfaces which may have the virus. So someone may cough or sneeze and touch a surface, and when they do that, they leave particles of virus on that surface. So if I come and touch that surface and then touch my mouth or my nose, then I'll be transmitting the virus from that surface to my body. So the mask also prevents us from touching those vital areas. Another thing that we need to do often is wash our hands. So washing our hands is important because, as I said, when you touch surfaces which have the virus and have the infection, then we can be able to transmit it to ourselves. But washing our hands will prevent or will actually destroy the virus particles, and it has been shown that soap and water is enough to destroy the virus because it has a protein coating. So washing our hands regularly, and this is regularly can be after every 40 minutes or so to avoid having contamination with the virus. Another way to prevent infections is to protect others when you're coughing or sneezing. So there's the cough or sneeze etiquette, which is either you cough or sneeze into a handkerchief or cough or sneeze into your elbow. So something like this. So that way you trap a lot of the particles which are going to escape from your mouth or your nose into your elbow, and that prevents it from spreading to other people. So a sneeze can travel quite far in terms of particles. I don't know that you can be able to see this diagram, and that is someone sneezing, and you can see how far the particles have been sprayed. So it's very important when you're sneezing or coughing to try and prevent that spread or spray of particles which may contain the coronavirus. So which are the areas that are infected and how does it happen? So as we said, in the initial infection is through the mucosa of the nose or the mouth or the eyes. So the particle is received by the receptors that can be able to accept the coronavirus into the cell, and most of the times it's angiotensin converting enzyme. And once that particle is entered into the cell in the nose or in the mouth or in the eyes, Then there's replication using the cell DNA replication mechanism, and this replication occurs at a very rapid rate, and now you begin to shed virus particles. So now these virus particles do elicit an immune response from your own body, and that is when you start developing fever, and in some people this response can be extreme. And in fact, it has been shown that the major problem about this novel coronavirus is the extreme body reaction to infection. So the body produces a cellular and a humoral response depending on your body structure, and these cells or chemicals that are being produced by your body to fight the virus end up injuring part of your body tissues, and most of the times it's the lung tissue. So it ends up injuring the alveolar tissue of the lungs, and this allows this prevents the lungs from opening, the alveolar from opening up and staying patent. When that happens, then the alveoli collapse, and we have what you call acute respiratory distress syndrome. Now this is the major problem in terms of respiratory tract infection for coronavirus. However, coronavirus has also been shown to affect other organs, especially small blood vessels. So we're talking about small blood vessels of the kidney, small blood vessels of the heart, of the brain. So some patients are getting other problems with the kidneys, the lungs, the heart, because of affecting of the small blood vessels. So this immune response, once it causes injury to the lungs, then the lungs are not able to perform the normal function of oxygen exchange, and these patients will develop a problem of oxygen retention in the body. So you find that the oxygen levels in the blood start dropping, and yet the patient is breathing normally. So that is a major problem, and this is where some patients may need oxygen supplementation in order to maintain the normal oxygen levels in their blood and to be able to maintain the normal function. In case some patients may have more severe symptoms, like proper acute respiratory distress syndrome, some of them may need to be intubated, meaning that a tube is put down their throat and oxygen is pumped into their lungs, and this is to help support the lung function. So this is usually a temporary response in order to just maintain the lung function. But with time, you give the body time to heal itself and to recover, and you can be able to continue the normal lung functions. So sometimes you hear that patients are in ICU and they're intubated. This is what is actually happening. The fact that the lung function is being supported so that they can be able to recover from the infection, and the body can be able to take over the normal function of respiration. So we've talked a lot about how you can prevent all this infection, and we talked about hand washing, we talked about wearing of masks, we talked about social distancing. But there's something else that we also need to talk about, and that is your body, giving your body the tools and ability to fight infections. And this is not just about coronavirus, but also any other viruses and other infections that your body encounters day to day. So you need to give your body the ability to fight these infections, and this is mainly through diet. So first, make sure you keep yourself well hydrated. Take a lot of fluids. They say about 2 to 2.5 to 3 liters per day. Make sure you keep yourself very well hydrated, and this also gives your body the ability to fight infections and keeps it healthy. Number 2, a balanced diet. So a balanced diet, mostly we're talking about adding vegetables and fruits to your diet. Now these fruits have certain vitamins which are very important. One of them being vitamin C, vitamin A, which can be found in green leafy vegetables and colored fruits. And this actually improves the immune function and helps your body to be able to fight any viruses, including coronavirus. Another thing that is very important and we may take for granted, and we have plenty of it in our country, and that is sunshine. Sunshine enables your body to produce what you call vitamin D. Now vitamin D is very important for immune response and also for developing immune function for your body. So make sure at least you get 1 hour per day of sunlight, and this will be able to develop your immune response and make it stronger. Now, there's also new studies that have shown that a specific mineral like zinc and selenium are very important in terms of developing immune response, especially to viral infections. So selenium is a trace element which is found naturally in soil. So most of the soils in the world have some selenium, but some soils actually have lower levels of selenium than normal. And this has actually been shown that it affects immune response and affects how your body will be able to fight infections. And in fact, even in the pandemic or prior, like HIV, it has been found in those countries where you had more selenium in the soil, the spread of HIV was actually much lower than countries where selenium levels were high. For example, in West Africa, in Senegal, where we have high selenium levels, we actually have also lower prevalence of HIV and actually also lower prevalence of things like cancers. So it shows that your body also needs selenium to fight cancers as well. And it's also been shown that one of the reasons why China has a lot of outbreaks of viruses, not only coronavirus but other viruses in the past, like SARS-1 and others, is because the soils in China also have low levels of selenium. So selenium as a replacement therapy is very important for giving your body the ability to fight infections. And this can be found in various supplements, including one of them being replenished. Okay, so selenium is very important. Zinc is also very important, not only for treatment, but also for prevention. So in terms of if you want to build up your body's immunity, you can take supplements of zinc or selenium to keep you in good shape to fight infections. One thing that's also very important is to keep your body healthy through exercise. So exercise in general enables your body to have a better well-being, to be able to perform better, and to be able to also develop proper immune responses to infections. So this is important. Make sure you give yourself at least 3 to 5 days of exercise of 30 minutes or 1 hour per day, 3 to 5 days in a week. So that gives your body the ability to fight infections and gives it a position of well-being. So I think I've mentioned most of the things that are important in terms of preventing infection and improving your body's immune response. I can also take questions, right? So that I can be able to understand maybe what the main concerns are and address them. Yeah.
Thank you, Doc. Somebody is asking if you can explain majorly the basic home care that mostly the government is talking about. Can you take them through that, like just the basic? If somebody you suspect or you have, how you're supposed to isolate yourself, and besides now the supplements and the specific people are taking concussions.
Yeah.
If you can explain that.
Okay, so there are two main things to talk about here. There's quarantine and there's isolation. So in quarantine is when you've suspected that you've been in contact with someone who is possibly infected and you want to prevent maybe spreading the infection to others. So in that case, you're not confirmed to be infected, but you're trying to avoid spreading because you have been in contact with others. So in that case, you're trying to isolate yourself and reduce the contact. And then isolation, where you have actually been tested positive and you want to give your body time to recover and stop shedding the viruses so that you can be able to then go out and not infect other people. So in isolation, what is recommended and what the government is trying to look for in terms of if you can be able to isolate yourself is that you have a place where you can be able to stay in a room by yourself. If possible, you can be able to have the essentials like toiletries and a place to be able to take baths and showers and go to the toilet in a way that you don't have much contact with other people, and you can be able to stay there for 7 to 14 days. Actually, they're recommended 14 days, and which time your body should be able to recover and your body should stop shedding viruses. So first of all, you need a room where you have as much self-contained as possible. You don't have to leave the room. If you can have someone to bring for you your meals, so that you don't have to leave and prepare your own meals, especially if you're living in a household with other people. And then if you have to leave the room, then you have to wear a mask and ensure that you avoid contact with many surfaces which other people are also in contact with. And then after 14 days, right now what we're talking about is if you're symptom free for 5 to 7 days, then actually you can be able, that's what the new WHO recommendations, that you can actually be able to leave the room. Now, when you're there, the main things are supportive management. As we said before, we have not yet documented a cure for coronavirus. So what you're doing is supportive management. So you're going to treat the symptoms that you have. So if you have headaches, if you have fevers, you can use paracetamol, which can be able to sort that out. Remember that most people are actually either asymptomatic, meaning there are no symptoms, or have very mild symptoms. And these mild symptoms are the cough, the fever, some headache, some fatigue. So Panadol can be used for sorting out fever or pains. Take a lot of water, because that will enable your body to be able to excrete and also to sort out the infection. And then take a lot of fruits. What is recommended also is taking ginger, lemon in a concoction, such some hot water and lemon. And that will actually also help in hydration and also give you vitamin C, which is essential. What is also important, if you can get, is supplementing a little bit with things like zinc, because zinc helps you recover quickly from infections, vitamin C as well, and selenium. Yeah. So I hope I've covered most of the important things that you can do when you're at home.
Now that guys are coming back to work, resuming, there is that tension. Am I safe? Is my workplace, are they taking care of the staff? So what can you tell the employees how to take care of themselves at work, as well as the employers, how they can make the employees feel comfortable? So just to remove that mental fear so that they can work well.
Yeah, of course, one major problem that has come with the coronavirus infection or COVID is stigmatization. It's important that we remember that anybody can actually get this infection, and it is not a death sentence in any way. So we need to actually start getting on with our lives with precaution. Okay? So what this means is that the things that we talk about, the social distancing, so if you're going to be going back to work, you need to find a formula on which you can be able to have people at work, but with distances between them that prevents direct contact or droplet infection. So we talked about 6 feet. So if that is possible, then you can be able to rearrange the office in a way that you can be able to have that. Make sure the office is very well aerated, have the windows open to allow air to circulate well, and this also prevents concentration of virus droplets in the air. You need to wash your hands regularly. So make sure there's soap and water in the office, that you can break out every 30 to 40 minutes, wash your hands, come back, continue working. That will also prevent contact of fomites, your hands and your face. Wearing masks, you can also continue wearing masks in the office, if especially the office has other people and the social distance is compromised, then a mask will also be very useful for that. And remember, it's not only in the office where you can get the infection. A lot of times we're finding that, yes, in the office you're very careful, but when you leave the office and you're socializing with your friends, your family, you let down your guard, and that is also a place where you can still get infection. So it's still possible to be able to go back to work and be able to perform with the correct measures.
Maybe now you can tell us about CityHealth Hospital and where guys can get the services that you offer.
Okay, so CityHealth Hospital is an outpatient facility which is offering comprehensive care, meaning we have all the services that you may need, from dental to physicians to specialist care, x-rays, radiology, pharmacy, lab. So we have a one-stop shop for healthcare. So this is a facility that is well thought out. In fact, probably we didn't think about COVID when we were starting it, but in retrospect, it is actually even well thought out for COVID because the spaces are very well aerated. The ceilings and the roofs are very high, so that gives it a very spacious feel, and that prevents also concentration of the virus in case. And we do have facilities which have made sure that we cater and prevent infections. We take care of our patients in a way that we make sure that there's no risk of infection from one person to another. And this hospital is located in the Central Business District on Tomboya Street, and it's on the first floor of Odeon Cinema. This is an iconic building. I believe most of us have heard of it or know it very well. So it's on the first floor, and you're all welcome to visit in case you have any issues, and we'll take very good care of you. So welcome everyone.